Glacier Bank's totally free checking saves you both time and money. Visit your nearest Glacier Bank office today. There's a convenient location near you. Glacier Bank, member FDIC, and an equal housing lender. And today from Logan Health Children's, we have pediatric hospitalist, Dr. Courtney Paterson.
Good morning. Thanks for having me.
Sure. Good to have you with us. Gosh, first thing I always ask a pediatrician, why pediatrics?
Oh, why not? No, for me, I never went to medical school thinking I was going to become a pediatrician. I actually thought I was going to become a surgeon. And then I did my first pediatrics rotation at a small practice in Spokane, Washington, and immediately fell in love with the patients and the staff. I was going to work every day. Everyone else wanted to be there. They were happy. They were taking care of kids. It was their life's passion. And so it created this environment of like, why wouldn't you want to work in that environment? And I never looked back.
Wow. And you went to school at the University of Washington?
That's correct, yeah.
Oh, go Huskies, right?
Go Huskies.
Yeah. And then you went down to Colorado.
Yes, at the University of Colorado and Children's Hospital, Colorado.
And Planet Boulder, as we called it. You do remember that.
Oh, yeah.
And Pearl Street Mall and everything.
Oh, absolutely, yeah.
Yeah. So that's how you get into your medical training. What happened after that?
So right after I finished residency, I stayed in Denver and worked at Children's Colorado and was able to see kids from really all over the country come there for their care. But both my husband and I are from Montana, and so we were always looking for a way to come back home and raise our kids in Montana. And so when the opportunity came from Logan Health to say, hey, we're going to build a children's hospital for all kids in Montana, I couldn't pass up the opportunity. And so 10 years ago, we moved home.
The Children's Hospital in Denver is really something. When I lived there, we used to ride our Harleys in and dressed as Santa Claus.
Yep.
Yeah.
Yes, that was a magical day for the kids. And we have been able to do so many great events in Denver. And now we're actually doing the same thing here in Kalispell. So I'm really excited to share later this month on July 24th at the Range Riders Stadium, we're having a night for children's to recognize all the amazing patients we've been able to take care of.
Wow.
And so we'll all be at the ball field.
Well, we'll talk about some of those patients that you've talked with and worked with over the years at Children's. But it's a unique thing here in Montana. I'm not sure we have another children's hospital here in this state.
We don't. We do have a lot of amazing pediatricians who, so many kids in Montana have access to a general pediatrician, but what makes our program different is the access to the pediatric specialists. So while your primary care provider can take care of 90% of routine health care, when kids get really sick, so something devastating like cancer happens, or they are in a car accident and need specialized care, that's what sets our program apart, that we're able to take care of those kids and keep them in Montana.
And keep their parents in Montana, too.
Yes, and their families and their support system around them.
Mm-hmm. What sorts of conditions or emergencies do you handle there at Children's?
Oh my gosh. In the last 10 years, we've taken care of so many different things. Everything from newborn babies who are having a hard time transitioning to life outside the uterus, to kids who, simple things like they had a bike accident and they need surgery to fix a bone, to new diagnoses of leukemia or a brain tumor, or a complex heart disease that kids can be born with, and everything in between.
A brain tumor for a child?
Yeah. We have a pediatric neurosurgeon, Dr. Kelly Schmidt. She's the only one in Montana that does pediatric neurosurgery. Absolutely phenomenal person and team of pediatric anesthesiologists, radiologists, hematology oncology physicians who come around and support those families when they come to us with a diagnosis like that.
Well, it seems to me, just from what you just said, that just about everything you do is on a miniature basis.
Yeah, we are able to provide the most comprehensive pediatric care in the state of Montana. And there are a couple things that we don't do. We don't do stem cell transplants because if you do that, you want to do enough of it that you do it really well. And there's only about 250,000 kids in Montana. So there's, on average, one kid every other year that might need that intervention. And so that's when we partner with bigger hospitals outside the state like Denver to take care of those kids.
But our uniqueness here is just the fact that this is dedicated 100% to kids.
100% to kids, and it's also Montana-based docs who are your neighbors helping to take care of your family.
Seems like just yesterday or maybe last year when Children's emerged, that big building.
Yeah.
And now it's been 7 years.
It's been 7 years. It's gone by so fast.
Well, let's review some of those 7 years with Dr. Courtney Paterson after this. We're talking with Dr. Courtney Paterson, hospitalist at Children's Hospital here in Logan Health in Seattle and Kalispell. We got a children's hospital in Seattle too.
That's correct. Yeah. Seattle Children's.
Yeah. So, we do have these major facilities for kids, but to have it here in our own town, that's a unique situation. And I'm not sure everybody thought it would be as successful as it's been.
Yeah, I think, people think that kids are healthy all the time, so why would they need a children's hospital? And for 90% of kids, that's true. But most children at some point in their life will have a major medical event. And so having the resources and the expertise to take care of them at that time is really critically important for not only them, but their families as well.
One of the most unique things I've seen there is this NICU department,
Yeah.
which has been around for a long time,
Yeah.
but the miracles that happen there.
Oh, it is absolutely magical to be able to take a moment of crisis where there's a family, there's delivery happening, something maybe is not going well. We need to take care of that baby as soon as possible and see that team descend upon a family and say, we got you. We're going to take care of you. And then be able to move that baby into the neonatal intensive care unit and care for them until they can go home. It's absolutely magical.
Yeah. And every year they have a reunion.
That's right. Every year we have a reunion, and now we've started a new program called the Hall of Hope. And so patients that would like to be able to share their stories with other families to give them hope. So in the middle of the night when they're really scared and something intimidating is happening, they can see that kids get better and kids go home.
Boy, that's fantastic. All right, let's talk about some of the things that you have been involved in the past 7 years at Children's.
So we have been able to grow from a small group of pediatricians and pediatric specialists. So when I got here, there were about 8 of us, and then we had 6 pediatricians. And since then, we've grown into a staff of over 65 people. Wow. And been able to add additional pediatric specialties that we're very lucky to have here in Montana.
One of the terms I kept hearing was subspecialist. Mm-hmm. What is that?
Oh, so it's folks like me who have done training in pediatrics, but then they've gone on to do one specific specialty within pediatrics. So, for example, pediatric hematology oncology. So they can take care of kids, but they only take care of kids with blood disorders and cancer. And so it's an additional sometimes 3 to 8 years of training beyond even what I did to be able to take care of those patients.
So what is your subspecialty?
So I do hospital medicine. So I just take care of kids that are sick and need to stay in the hospital, or newborn babies that are not quite ready to go home.
So you're the one that just kind of keeps the lights on while
That's right.
while they heal.
That's right. And that's the amazing thing about kids. You put the right support around them, and the vast majority of the time they get better.
I'll bet you that you have seen some, and I don't know how much you can talk about the successes you've had there, but I would love to hear maybe just some of them.
Sure. I would say, so right now, this family's given us permission to share his story, but the community may remember not that long ago, we had a really devastating event where there was a lightning strike in town.
Oh, sure, yes.
And so Mason and his family are back this week, and we're celebrating his success, the fact that that terrifying event happened. He survived, recovered, was able to walk out of the hospital, and now he's back and we're celebrating him. So that's one example of thousands that we can give of something devastating and unexpected happens, and this community and Logan Health Children's just wraps their arms around a family and takes care of them.
Didn't he pitch the first pitch
Yes,
at
he
the
threw
game?
out the first pitch this week at the game
I thought so,
on
yeah.
Tuesday. Yeah.
Well, that's really something. A soccer player out on the soccer field, and, we just didn't see that lightning coming.
Right. And that's what happens with kids, as any parent will know. Something unexpected happens that you didn't plan for and you weren't expecting, and all of a sudden can change your day from something normal to something devastating.
And so I guess the question is, where do these kids come from? Not just here.
Oh, they come from all over Montana. We've taken care of kids as far away as Glasgow, as Glendive, who come here because of the pediatric specialists. And a lot of that is our pediatric surgical team. So being able to have a surgeon who only takes care of kids and the full scope of what those children might need is absolutely fantastic. Kids who need critical care. So sometimes, for the example of you have a devastating event like a lightning strike, it requires a team of 10 to 15 people to take care of a patient like that, and for weeks at a time. So to be able to keep him here and take care of him and help him walk out the door, to be able to go home and go back to school, was phenomenal.
And eventually play soccer again.
Yeah.
Fantastic story. One of the things that I've always wanted to ask a pediatrician, and now I'm going to ask you.
Yeah.
Okay?
Okay.
This is right out of left field.
Okay.
There are some specialty hospitals out there that work with kids that, that we hear a lot about. We hear about the Shriners hospitals, for example. We have one in Spokane. We have, of course, St. Jude.
Yeah.
How do you interact with them?
So we interact with those partners, as cases come up where we need their expertise. So Shriners does pediatric orthopedics. There may be an occasional kid because of maybe how they were born or an accident that they were in that needs that specialty expertise. And so the great thing about being in the pediatric realm is that we're all in it for the same reason. We just want to take care of kids. There's no ego in it. There's no other agenda. We just want to do the right thing for kids. So when we need their expertise, we call them, we connect those families. We have social workers, case managers here in Kalispell who can help make those connections, make sure the family has a way to get there and a way to get home. And so we know that it takes a huge village to take care of pediatric patients and provide the highest level of care for them. And so we love reaching out to those partners when we need them.
Well, Shriners, of course, here in Kalispell supports that hospital in Spokane, and being able to call on these guys. There's not a whole heck of a lot I won't do for a Shriner.
Yeah.
I got to tell you, these guys step up whenever they need to. But I also, in my former time in this business, got to spend some time at St. Jude.
Yeah.
And what I saw there just absolutely put me on my back.
Yeah.
At just the miracles that happen in that place. And Danny Thomas simply said he just considers kids not being able to be treated for things like that as totally unacceptable.
And that's how Logan Health Children's is as well. Of that child, you pick them up in the moment and you just take care of them. And there shouldn't be any barrier to care, especially a financial barrier, because kids deserve to be cared for. And to have access to that care, and their families deserve to be supported. And that's what Logan Health made the commitment. We're going to do that for the kids in Montana.
Well, that's an investment in our future, too. These are the kids that might someday run the country. These are the kids that might someday find a cure for cancer.
Yeah. And we've been able to experience that just in our short 10 years here, that we've now had medical students that have rotated with us during training that are now back, and there are physicians who are my partners on staff at the hospital.
Wow.
And that, that's the magic of working in this place, because that is the environment that we thrive in, that we're all there and we're very passionate about taking care of kids.
Outreach, that's another part of what you guys do at Logan Health, and we'll talk about that after this. And today we're talking about the 7th anniversary of Logan Health Children's and hospitalist, pediatric hospitalist. Well, let's see if I get all that right. Dr. Courtney Paterson is with us, and there's a lot of outreach that you're able to do at Children's. Talk about some of that.
So our pediatric specialists travel more miles per year than any other physician in the state. I'll challenge everyone that. So we added it up one year, and everyone all in traveled over 100,000 miles per year, so that we go to the patients rather than expecting the patients to always come to us. So it may be that a child needs a surgery, so they have to come to Kalispell for their surgery, but let's say they're from Helena. They may come to us for a couple of days, have their surgical procedure done, and then go home and never have to come back here, because our team is going to Helena to see them for every single follow-up visit. And that's what sets our program apart from those bigger centers like a Seattle or a Denver, of that you may make one trip to us, but then never have to come back here. And that's our goal, is because we want to meet patients where they're at. And so this past 12 months, we did over 30,000 visits in our pediatric program between Kalispell and our outreach sites. So,
how big is the staff?
So our staff, right now we have a little between 60 and 70 people total between our physicians. And then adding in our nurses, we have over 100 people within the pediatric program.
And those are the people that fan out throughout the state and do follow-ups.
That's correct. So we go to Great Falls, Helena, Missoula, and Bozeman, and soon Billings, now that we've merged with Billings Clinic, to be able to take care of patients no matter where they are.
How much follow-up is required. Are we really able to cure some of these kids and set them on their own without ever having any further medical needs?
Yes. So one of our huge successes has been our oncology program. And we now have been in place long enough that patients who have come to us with a new diagnosis of leukemia, we complete all of their therapy here. And on the day that they finish their chemotherapy, we have a very special celebration where they come in and they get to ring the bell to say that my chemo is done. And so folks may have seen some of those on the news and on our social media channels to be able to celebrate those kids. And now we have patients that have been 5 years post-therapy. We just see them once a year to check in and make sure things are going okay.
Miracles are happening at Logan Health Children's. There's just no way around it.
Absolutely. And that's why we're there, is because kids are amazing. Kids are not little adults. There's just something special about them. And that's what keeps us going back to work every day.
The one thing that I have to ask you about, though, is how do you handle it when it doesn't go as planned?
Fortunately in pediatrics, it's rare that happens. But that's why we have a team of people to take care of the patient, their family, and actually each other. It is really hard when kids are critically ill and we don't know what's going to happen. Despite all of our efforts, sometimes it doesn't turn out the way anyone wants. And that's when it's so important to have people's support system around them, and why it's so important that they don't have to leave Montana for care, because then you don't want to have a parent alone in a huge city 8 hours away having something devastating happen with no one who's part of their family with them. So that was the real mission of Children's, we don't want that to ever happen to another Montana family.
Fantastic. Well, congratulations on 7 years. Boy, we'll be talking again in probably another 7 years, but of course, between now and then, we'll have many conversations about the future of Children's. I know we still have that third floor.
That's right. And so there's lots of opportunity for growth. Our valley's growing, the state is growing, and we're here to help.
Dr. Courtney Paterson, thanks so much.
Thank you so much.
It's Glacier Bank's Community Conversations, a service of Glacier Bank where your checking is totally free. Just about anywhere you are in Northwest Montana, you'll find a Glacier Bank office nearby. Keeping you connected to your friends in your community, an important part of the mission of Glacier Bank, member FDIC and an equal housing lender.